I'm Barbara Cappelli. I'm a pediatrician and I always worked with bone marrow transplantation and hematology in children. And now I work for Eurocord in Monaco Principality. Tomorrow morning I will present the results of a survey on HLA-identical sibling transplantation in sickle-cell disease patients. Sickle-cell disease is a very common hemoglobinopathy and the only curative therapy that there is for sickle-cell disease is transplantation. However, indications for transplantation are still not well defined, and many barriers several barriers prevent its widespread application, such as lack of a suitable donor, lack of information, or limited understanding of transplantation. Moreover, transplantation encompasses some complications, early and late onset of complication. In order to better understand the role of transplantation, we collected EBMT and CIBMTR cases, and we collected 1,000 patients who were transplanted from an HLA-identical sibling throughout the States and EBMT referring countries. These patients underwent an HLA-identical sibling donor transplant after a myeloablative conditioning regimen in 87% of the patients, or in 13% of the patients they received the reduced intensity conditioning regimen. Results were very good and very encouraging. We had a good engraftment of 98% for neutrophils and 96% for platelets. We had a limited GVHD with 13% of chronic GVHD and 14% of acute GVHD, and we had a very good event-free survival of 90% and an overall survival of 94%. So these data these excellent data on overall survival and event-free survival make us, with limited toxicity, although many have used the myeloablative conditioning regimen, can show that hematopoietic stem cell transplantation from an HLA-identical sibling is feasible. And these data should help us to early refer the patients with severe sickle cell disease to hematopoietic stem cell transplantation if they have an HLA-identical sibling donor. I think that if patients have a severe sickle cell disease and have an HLA-identical sibling donor, the transplantation can be feasible with limited risks and a good overall survival and a good event-free survival.